Hello everyone. Today our presentation will be focusing on prostate imaging, specifically looking at the technology and the risks involved in the process. But before we dive into the specifics, here is some basic background knowledge on prostate cancer and the imaging involved. The prostate is a small, walnut-sized and shaped gland, deeply embedded in the center of the pelvis, where it produces a milky fluid that carries sperm during ejaculation. Wrapped around the urethra, it sits just below the bladder and is known more for the problem it causes rather than the function it serves. It was thought to protect against urinary tract infection, but the prostate is not necessary for normal sexual function, nor is it clear that it has a direct influence on preventing urinary tract infection. Prostate cancer is the most common non-cutaneous cancer in men, making the diagnosis and staging of this cancer of great medical and public interest. Although prostate cancer can be slow growing, the disease nonetheless accounts for almost 10% of cancer-related deaths in males, with thousands of men dying of prostate cancer each year. Rapid technological advances over the last few years have enabled the mainstream use of prostate imaging for the clinical management of prostate cancer. Imaging modalities such as multiparametric ultrasound, multiparametric MRI, and nuclear imaging such as PET are now being used for all facets of prostate cancer, including diagnosis and localization, whole gland and focal therapy, staging, active surveillance, and recurrence monitoring. An ultrasound machine consists of a transducer and a CPU, or computer connected to a display. The transducer is passed over the area of the body that covers the prostate and emits sound waves at frequencies ranging between 1 and 10 MHz. In turn, the sound waves are reflected back to the transducer after they bounce off the structures that are the focus of the ultrasound. The CPU measures the echo intensities and speed, and these measurements are converted into electronic images that show up on the machine's monitor. Magnetic resonance imaging, or MRI, is a scanning technique for creating detailed images of the human body. The scan utilizes a strong magnetic field and radio waves to generate images of parts of the body that can't be seen as well with X-rays, CT scans, or ultrasound. An MRI scanner applies a very strong magnetic field, about 0.2 to 3 teslas, which aligns the proton spins. The scanner also produces a radio frequency current that creates a varying magnetic field, which allows protons to absorb its energy and flip their spins. When the field is turned off, the protons gradually return to their normal spin in a process called precession. The return process produces a radio signal that can be measured by receivers in the scanner and made into an image. PET stands for positron emission tomography, and it is a nuclear medicine imaging test in which a small amount of liquid radioactive material, which in most cases is fluorodeoxyglucose, is injected into the bloodstream. This sugar accumulates in the body, where it gives off energy in the form of gamma rays. These are then detected by the PET scanner, and a computer converts the signals into detailed pictures or images showing the prostate area.
The risk of prostate imaging varies depending on what technology is being used. If an ultrasound-based technology is being used, they don't carry any harmful effects on an average patient due to ultrasounds using sound waves. If an MRI-based technology is being used, they can potentially carry the risk of giving a patient nephrogenic systematic fibrosis, which is a rare complication. It is believed that it is caused by injecting high doses of gadolinium-based contrast material into patients with poor kidney function. There are also very slight risks of giving a patient allergic reaction if a contrast material is being injected. But generally, MRIs don't pose any risk to an average patient. If a PET-based technology is being used, they also don't carry any harmful effects on a patient besides the exposure to radiation due to the nuclear medicine being used.